purpose of this training is to provide a video to show the differences with the new Nextgen upgrade that will be in place December 10th, 2018. So right now I'm in the patient Jonathan Law homepage. And I'm going to scroll down to the vital signs section, and this is only within the home page. You can view all the vitals from past visits. So as you can see, it's going all the way back to 2014, 2013. Everything, the height, weight, blood pressure, the position, which side the blood pressure cuff was on. And again, this can only be seen through the home page. So when you go to the intake, this will not be available. So the next difference is documenting the reactions for allergies. Same concept, the look is just different. I'm going to click update. So this section is still the same. Where you click on an allergy, you type the first three. Say apples. And then for the reaction, I'm going to click add, and this box pops up. Make it bigger. Okay. So just like with the old Nextgen, you have a lot of reactions that you can choose from. I do encourage you to look through the list to see what options there are. However, you can still free type up in this box here if the reaction is not in the list. So we're going to say the patient gets hives. For every reaction, you want to mention the severity. And then you click add, and it adds it. Let's say maybe they get dizzy too. And for that one, it's mild. Just click add, and that ends up in the box here. Click OK. Now, before you leave this box, you want to click add so that it can show up in the main area. However, you can edit. You can add more if you need to, or you can edit what's already there. They say, well, no, the hives isn't really mild to moderate. It's really bad and it's severe, and you can change that. And then if you want to add, you just click the box again to add another reaction. If they say no, they don't get dizzy, that's with different allergy. You just highlight dizziness and delete. But again, in order for this new allergy to appear at the top, you want to click add. And you're still able to edit at any point. You just highlight Apple, and then you can make the necessary changes. There's still a comment box down here for any additional information. Okay, so the next difference is tobacco use. If you scroll down further, there's now a vaping use section for the patients to say that they don't smoke cigarettes, they don't chew tobacco, they vape. I just want to review the tobacco use section while we're here. The question actually should not be, do you smoke? The question should be, do you smoke cigarettes or use any other tobacco products? Because we don't want patients to get confused about the act of smoking when we're really just trying to review their tobacco use. So if the patient says no, your next question should be, have you ever smoked cigarettes or used other tobacco products for a period of time? And if they say no again, And that then you can click no never, because when you click no never, that means no, they've never used tobacco products. However, if you ask that question if they've ever used it in the past for a period and they say yes, then you'll click yes. And then you'll ask them which one it was, say it's cigarettes, and you want to make sure that you record the age they began and the age they stopped. And then, of course, if the patient says yes to using tobacco products, you would just select which one, and you want to record whether it's daily, and if it is daily, how many per day? Is it one pack, one cigarette, and the age that they began smoking? And then for the tobacco users that are still currently using tobacco, you want to review their efforts to quit tobacco. So if they've never tried, that's no never. But if they have tried, you would choose the tobacco type, the date that they quit, if they remember, and how long they've been tobacco free. Often tobacco users, when they do stop, they go back on. You just want to know, not using tobacco products, how long was the period of time? Their cessation method, which was their method to stop smoking. When you choose here, you also have the option of free type if it's not in the list. And then the relapse reason. Why did they go back to using tobacco products after they've had some time of not using it? And then this one, you just free type. However, you may come across patients that say, no, I don't smoke cigarettes, I don't chew tobacco, but I vape. So in this case, so we're not asking the patient, do you vape? However, if the patient does mention that they use the method of vaping for their tobacco use, you would still click yes for tobacco use because they are using tobacco. But then you'll scroll down to the vaping use section. For vaping, you would click yes. And the only thing you're doing in this section is clicking whether they're that they are a current user. Because again, we are not asking them if they use the vaping method. So we wouldn't select not a current user. This is only if they say that they vape. And you click OK. Okay, so the next change is in the orders module with immunizations. The law had the flu ordered for him. We're just going to go inside the order. All right. So as you are all aware, in this case, this patient is not going to get VFC. They would get private. But I just want to show the functions, the different functions that are now going to show with the upgrade. So you already clicked VFC when it's a VFC patient. Then you choose the reason. The most common is Medicaid or uninsured. The difference is the funding source. You have different options. So for VFC, you're going to choose public VFC. If you have VFAR vaccines at your site, at this moment it's just Chinatown, you would choose public non-VFC for the VFAR patients. But you'll still check off VFC like normal, but you just won't choose public VFC. For VFAR, you're choosing public non-VFC. Now, for patients that will receive privately funded vaccines, this flow is still the same. You keep the VFC reason box empty. In this case, it'll be not VFC eligible. And then the funding source will be private funds. This will not appear in the upgrade. It's here now, but it won't be there. So you will only have 3 options as opposed to 4. So another difference is the save and send button is no longer a part of Nextgen in the upgrade, which means the save button functions as the save and send. Now this is very important because once you click save, any information that's in here will get sent to Kids Plus. So you still go through the same flow of clicking the drop down box and checking the lot number against the lot number that's on the vial. So after you're done this, you go out, then you administer the vaccines. And once you administer the vaccines, then you'll go back in, choose a lot number, the site that it was given, and your HPV documentation still goes down here. Then you click save, and that information will go to VFC. So if you're an MA that does all of this ahead of time and click save, and then you go back to click save and send, number one, that is the incorrect flow. Um, and number two, since the save and send button is no longer an option, you should not be using that flow. The difference is spell check. Nextgen now offers spell check before a document is generated. Normally on a document when it's generated, it has little red lines and green lines underneath it to show that there was an error. Well, now it can be caught ahead of time. So I'm just going to spell the word wrong. There's a red line underneath it. So that's very helpful. So you can make sure that everything is spelled correctly. If you have screening questions with the line underneath it, you can now catch it ahead of time so that you can modify your screening questions because a word is spelled wrong. So this is everywhere. I have a red line underneath it. Birth history is another area that has a slight change with the upgrade, and it's just how the time of birth is recorded. You also now have the option to choose spontaneous or induced. For the time, there's a drop down arrow. You click that and simply record the time and select whether it was AM or PM. So I'm using my keyboard to type in the number. That's an option so that you don't have to click on these numbers. You wouldn't really ever have to fill out the second. Click OK. Difference with the HPI selection for well child visits and the reason for visit section here. Slight difference. Another change that will affect the MAs is the checkout section. For patient education, normally in the checkout template, you know if there's patient education that needs to be printed because there's a number next to it. Just like you know if there's referrals to be printed, there's a number next to it. Um, Most of the time, that's how it will show up. The flow won't change, but always check this patient education section. This will be right underneath the check boxes in the checkout template. So if you don't see a number next to education, just make it a habit to check down here to see if there's any patient education, and you can print it from here. The last change that will affect the MA team for the upgrade is in office procedures. You can usually access this through standing orders, the diagnostic tab, the orders module. specifically for the wave testing. This area here where you normally click completed for the pregnancy test and you put the result in. Also for the MAs that interpret PPDs, you use this section when documenting the result of the PPD. Now, before you click submit to Superbill, you want to click this update button if it pops up. So this update button won't always appear, but you will not be able to save and close the template until you click update. So if you put your result in this way and you notice that every time you try to click save and close, you get an error message, most likely it's because the update button is here and it hasn't been chosen. Now this update button won't show up every time, but if it does, you just simply click update so that you're able to submit the Superbill and save and close.